Hey everybody, this is Dr. Paul Thomas with Plum Health DPC, and today I'm talking about a paronychia. A paronychia is an infection of the nail fold or the tissue adjacent to the nail of the finger. They usually concentrate in this area distal to the distal interphalangeal joint. There's two joints of most fingers, the proximal interphalangeal joint and the distal interphalangeal joint. Most paronychia are adjacent to the nail bed, distal to the DIP joint. For most people, they usually get a manicure, or they get a splinter, or they're gardening and they irritate the nail bed and some bacteria gets underneath the fingernail tissue or the cuticle that's overlying the fingernail, and it creates this infection. We recommend that they soak it in warm water to decrease the pain and swelling, and allow the pus to drain out on its own. Sometimes, like in this case, the pus stayed underneath the nail bed, and so what we did is we lifted the cuticle away from the nail and then applied some gentle pressure to remove the vast majority of the pus from the finger. This can be done with an 18-gauge needle, which is what we're using in this case, or it can be done using another tool for blunt dissection. You can see that I'm just going just underneath the cuticle, lifting away the tissue and allowing that purulent fluid to drain out. This video was recorded later in the procedure. I had already drained out maybe 1 or 2 milliliters of the pus. Total drainage on this was about 2 or 3 mLs of pus, or a little bit less than a teaspoon of pus. This is really helpful for the patient because it takes the pressure out of the joint. You can treat this with an oral antibiotic and some pain management like ibuprofen, 600 milligrams every 8 hours. If you're concerned about MRSA, you want to use Bactrim or trimethoprim and sulfamethoxazole. If you're not concerned about MRSA, you can use cephalexin or Keflex. Thanks so much for watching and have a wonderful day.